Hey guys, Nurse Alyssa here. Today we're going to talk about Adaptic, but first if you could hit the like and subscribe, it would be greatly appreciated. So let's get started. Adaptic is a petroleum impregnated dressing that is used for moisture balance and to create a non-stick barrier so the cover dressing doesn't actually stick to the wound, because we always want to protect the wound. So if we have a cover dressing that's always sticking, even though we put saline on it to release it, we want to protect the wound base. So this does not have any antimicrobial properties. It is just a petroleum layer so that the dressing doesn't stick to the wound and it can come off easy. So you're going to use Adaptic when you have a wound that doesn't have a whole lot of exudate and you find that the cover dressing is sticking to the wound base. So then you would use the Adaptic to provide that layer to decrease wound-based trauma, because we always want to protect the wound because that's what we're trying to heal. So if every time we're taking off the cover dressing and it's we might not even be able to see it, but if it's sticking, it is pulling up some freshly grown tissue there. So we definitely don't want to be doing that. We want to add a contact layer. So there is no antimicrobial properties to this. It's just to prevent trauma to the wound base. So precautions, you're not going to use Adaptic with any other silicone type product because their function is the same thing. So it'd be two products of pretty much this exact same thing. It's just a waste of money. Contraindications, so you're not going to use this product if somebody has a sensitivity or an allergy to petroleum. And you're also not going to use this if somebody is having hyperbaric oxygen therapy. You're not going to use this product. We're going to use Adaptic. First, we're going to clean the wound with normal saline. So you're going to clean any debris out of the wound base and the peri-wound. You're going to clean it very well, and then you're going to dry the peri-wound tissue. So Adaptic can be cut, but you want to choose a size that overlaps the peri-wound by 2 centimeters. So you're going to put the Adaptic on the peri-wound. So you have your wound and it overlaps by 2 centimeters. So you're going to put just a single layer of Adaptic. This allows any exudate to flow freely through the Adaptic to the cover dressing. So you're going to choose an appropriate cover dressing to manage the exudate. So to remove the Adaptic, you're going to carefully pull the dressing away from the wound using your forceps. Now, if it does still get stuck on there a little bit, just add some saline, wait for a few seconds, and it should release nice and easy. So you should change this. It's a max of 7 days that it can stay on the wound. But depending on your exudate, you'll have to change it more frequently. So when you start to see the exudate coming through your cover dressing, you're going to want to change it. So the expected outcome of Adaptic is that the cover dressing doesn't stick to the wound. So that's what you're looking for. So that's all I have for this video. I'll catch you next time.